Snohomish County has declared a measles outbreak after confirming 3 new cases in unvaccinated children. Those kids attended 2 Mukilteo schools while contagious. This outbreak stems from a contagious family visiting from South Carolina. Health officials say the 3 new children infected had contact with that family. Take a look here at your screen. These are the locations and dates. The kids involved in these newest cases were at Pathfinder Kindergarten Center and Serene Lake Elementary, both in Mukilteo, last Friday. They also went to Swedish Hospital in Mill Creek on Tuesday. Doctors say if you were at one of these locations on the same day and time, check your immunization status. Separately, Central Washington University in Ellensburg says a student just tested positive for measles there. The school says exposures happened last Thursday at the Student Union in Samuelson Hall and Friday at the Flight Training Center. At this point, health officials do not know whether this is related to the Snohomish County outbreak. Joining me right now is Dr. James Lewis with the Snohomish County Health Department. Doctor, great to see you again. Unfortunately, under these circumstances, it's not the update that we wanted.
No, it's not. Yeah, thanks for having me here, though, to highlight the problem. I appreciate it.
So let's talk about these newest cases, these 3 new cases, and the county already declaring it an outbreak. So that's 3 cases or more, correct?
Correct, yes, and that's defined nationally. So.
Okay. And can you tell us a little bit about what we know and then any concerns you have, particularly of the locations that they were at?
Yeah, so we know these 3 cases were connected to the cases that came through from South Carolina. They were direct contacts. And the locations they were at were the 2 schools and then Swedish Mill Creek. We have been contacting a lot of folks there, including staff and students, and then the people who were at Swedish Mill Creek. And the concerns are still mostly for people who are unimmunized, which we have identified a significant number.
Okay, and the county has said in their press release and information we've gotten into the newsroom that you are expecting more cases. Can you tell us why and what the incubation period is?
Yeah, so measles is one of the most contagious infections we know of, and if you go into a room, where someone with measles is, you can expect 9 out of 10 people to come down with measles if they're not immune, if 10 people went in there, and that includes up to 2 hours after the person with measles left the room. So that's why it was particularly concerning. And we do see relatively mild cases of measles. It can happen. So I do think there's cases out there that we have not identified yet because people are staying home and not seeking health care. So I do think there's more cases right now, and I think we will find additional cases. The incubation period for measles is on average 7 to 14 days, but can be as long as 21 days. So we would still expect to see cases even from that last exposure at the beginning of the year with the folks from South Carolina.
Okay, with that South Carolina family, then that could still be people could still be reporting those illnesses. These latest ones, though, we could only see being reported if someone got infected from these latest cases in a week or 2.
Exactly, yes.
Okay, so there's some lag time there. And let's talk a little bit more quickly about the schools and the hospital where these latest cases visited. Obviously, those are some places that could have very vulnerable populations, right?
Yes, absolutely. So we do see people who are immune compromised seeking health care, so we're always concerned about healthcare settings. In the schools, these 2 schools in particular have relatively good immunization rates, so both are above 90% is what's reported to the Department of Health, which is excellent, but still we're talking about hundreds of people, so that's still tens of students who are potentially unimmunized and at risk.
And while we just have a little bit more time, I would love for you to help me out, because when we post some stories like this, especially on social media, people tend to get fired up on their opinions about vaccines in general right now. But there are people that can just simply not get the MMR vaccine, whether it's because of age or other reasons, right?
Right, so the initial dose of MMR is not recommended until 12 months. So we have a lot of kids out in the community that are less than 12 months old, and they haven't had that opportunity, even if their parents do want them to get a vaccine, to get immunized. And so those kids are now at risk because of the measles spreading in the community.
And any other advice for our viewers watching, any big takeaways if they're watching from that area? Yeah,
I think if you have unimmunized folks, just be very careful about what you're doing. Try to avoid large public spaces right now. We do think there's probably community spread going on if you can. And then otherwise you can wear a mask to try and reduce risk. Okay. It's not perfect, but it can help. And if you get sick, stay home, and that will help avoid spreading it to other people. And then the big thing is people should just know their immune status and the immune status of the people in their house. and you can talk to healthcare providers or public health to try and help figure that out, or check the immunization registry website here in Washington. Your records might be there.
And doctor, thank you so much for being here. We're going to try to post all the information we can about this story on king5.com so people have resources there. And we can't stress this enough, if you do have symptoms, call your doctor, don't just show up, right?
Yes, absolutely, because then they'll get you to a room and isolate you away from other people as quickly as possible.
Okay, Dr. Lewis, thanks so much for being here.
Thank you.